You're beautiful and we value you. Let's empower you. You're beautiful and we value you. Let's empower you.
At Copper Rose Zambia, we're inspiring and motivating future leaders and promoting the empowerment of women at a young age. Our mission is to make a difference in the lives of women and adolescents by educating them about their sexual reproductive health and rights and responsibilities so that they can exhibit independence and self-worth in order to reach their full potential and be effective leaders of change in their communities.
You're beautiful and we value you. Let's empower you. You're beautiful and we value you. Let's empower you.
Hello, everyone. I think we're just about ready to start now. Good afternoon, good evening. You can just type in the chat box where you're connecting to us from and how your day is going. And you can just type your name and where you're connecting from. Otherwise, I'd like to welcome you all to the Menstrual Hygiene Day webinar. Today is 28th May, which is Menstrual Hygiene Day. And I just want to thank you on behalf of Copper Rose for joining this really great event. We had planned some really grand in-person activity, but we're not able to do this because of COVID, and I'm happy that we have still been able to do this. So the first thing I'll talk about are housekeeping rules. First of all, I'm happy that we're all muted, and if you're not muted, you might want to do that. You can turn your video on, but it would be great if your video was off because it will improve the connectivity for those that have issues with connections. The hashtags that we'll be using today are MHDay 2020. We'll be using the hashtag Candid Pride and the hashtag Periods in Pandemics. It's really exciting. There's about 40 people on the call, and it's been fluctuating really from 40 to about 70, but it's just exciting to see all of you joining in. Before I bore you with my talking, I will just ask the speakers to switch on their video so that we can all see them. Okay, great. I'd like to welcome our speakers. Thank you so much for joining us. I will not introduce them because I might not give them the credit they deserve. So I'll ask them to introduce themselves. We'll start with Mwangala, and then Kasweka, and then Nelly, and then Dr. Simpungwe. So we'll just ask our speakers to introduce themselves.
Good afternoon, everyone. Happy Menstrual Day. My name is Mwangala Mulundano. I'm the Behavior Change and Communication Advisor for S&D under the Urban Sanitation Project. Thank you.
Good afternoon, everyone. My name is Nelly Kanjele. I'm the Dreams Officer at Pact, Zambia. Thank you.
While we're waiting for Kasweka, Dr. Simpungwe. I think you are muted.
Muted, okay.
Yes.
Okay, good afternoon, everyone. I'm Dr. Kakungu Simpungwe, Assistant Director, Adolescent Health. I'm based at the Ministry of Health.
Thank you so much. And our last speaker is Kasweka.
Good afternoon, everyone. Sorry, I was muted at first, but I'm Kasweka Chinyama from the Ministry of Education. I'm the Menstrual Hygiene Management
Thank you so much, Kasweka. Your line was breaking a little. I'm not sure whether it's just me, but I think we all heard what you had to say. I'm just seeing from the chat box, there are people connecting from Mbala, from Ndola, from Lusaka, and there are some people connecting from Kitwe as well. Thank you so much for joining us. So the plan of events is that we didn't want a panel discussion where people will just be making presentations, but we wanted a discussion which will be rich and will allow people to make contributions and have something that is fruitful. So the way things will run is that this session will run for about 1 hour, 30 minutes, and we will start with some questions that we have prepared for the speakers. Thereafter, we will have questions from the chat box, and we'll have more questions coming in from the email. First of all, I will also be sharing some menstrual hygiene facts, and I've prepared 10 facts that I want to share with everyone. I'll just ask people to mute themselves. I can hear some feedback from some of the people on the call. So I'll ask you to mute yourself. The call automatically mutes you, but I've noticed that some people have been unmuting themselves. Please mute yourself to allow us to have a very fruitful conversation. Yes, so many of us are not sure or are unaware what the fuss is about Menstrual Hygiene Day. Menstrual Hygiene Day is a day that was started sometime in around 2012. And the idea was to increase and improve the knowledge that people have about menstruation. So a lot of people ask what is the day about? So the day is 28th May, and some people may not know this, but the fun fact is that the day is 28th May because the average number of days, or the average cycle of a woman, is 28 days for most women. And for most women, each menstruation lasts about 5 days. And that's why it's 28th May of any year, because May is the 5th month and 28 days is the average cycle. So yeah, that's a fun fact for today. And I'll be sharing some other fun facts throughout the conversation. But before we go on, I would like to ask those that are just joining to type in where they're joining from, and we will start out with the first round of questions. Before I get into that, I just want to introduce myself. My name is Natasha Salifyanji Kaoma, Dr. Kaoma, and I am the Chief Executive Officer for Copper Rose. And for those that may not know, Copper Rose is an organization that is youth-led and youth-focused, and we've been working on menstrual health management for the last 5 to 6 years. And initially it was our flagship project, and that's why we're very passionate about it. But over the years, we've realized that girls and women have many other needs, which we meet through our programming. We have programs in menstrual health management, of course, but a huge part of our programs now is in the general sexual and reproductive health and rights umbrella, family planning. We're also doing work on women's economic empowerment, leadership and mentorship programs as well. Our portfolio really focuses on women and young people, and that's what most of our work is on. And our vision is a world in which young people and women are happy, healthy, and living to their full potential. So it's really great to be here. And for those that are joining again, I will say you can type where you're connecting from. I can see Suzanne from South Sudan. And so do not be left out. Feel free to type where you're connecting from. I can see you, Alex. And yeah, it's great to be here. So we'll start off with the first round of questions to our panelists. And I'll ask some of the panelists to have their videos back on. The first one is for Kasweka. And Kasweka is coming from the Ministry of General Education, and she's the menstrual health focal person. So there were lots of questions that we're going to her, but I will ask her this one for now. And my question is, Kasweka, is it very common for girls to miss school in Zambia? Coming from the Ministry of Education, what can you share with us about this?
Okay, thank you very much. This is one of our biggest challenges that we have as a ministry. In most of our schools, as you know, when girls start attending the menstruation, it is very difficult for them, and absenteeism is one of our biggest challenges. The fact being that we all know that when a girl is undergoing menstruation, when it's that time of the month for them, First of all, there's an issue of having the sanitary towels, if they do have them, if they can afford them, because for one to go to school, you have to be clean. So because most of the learners, especially in rural areas, even in urban areas, cannot afford sanitary towels, absenteeism for girls during the time of the month for them is very high. I can give an example. It takes 5 to 7 days in a month. This is the time that a girl will be menstruating. So if you calculate that, if you say 7 days, that's like the longest. So if you times 7 days by the 3 months, you have like 21 days. So that's 21 days in a month. And if you multiply that by 3, it's almost close to a term if you just add those days. So when we did our research as a ministry, we came to a conclusion that a girl can actually miss almost a term of school per year because of the challenges. This is one of the reasons, and it's evidence-based from our that girls do actually stay away from. One of them is they can't afford to get sanitary towels, and then also they experience body pains. This can also make the girls stay away from school. And there are also other challenges that they face, even the fear of being bullied at school. So because of various reasons and challenges that the girls face during menstruation, most of them are absent from school.
Thank you so much, Kasweka. That is very true. I have seen it in myself in some of the areas that we work. Just seeing how nerve-wracking it is for someone to not go to school. A friend of mine challenged me actually a few years ago. They said, try being in your period, try not using anything just so that you can see what it feels like. And I think that's something I'll ask some people here to try, just so that you know what it feels like not to have protection. And sometimes it gets you to be more passionate about helping others. Thank you so much, Kasweka. My next question is for Nelly. Nelly is the programs officer at Dreams, which is under Pact Zambia. So Nelly, what is the situation of menstrual health products in Zambia? For those that may not be aware, Pact has a flagship program known as the Causal Girls program, where they produce some sanitary pads. So Nelly, are you able to share with us what you've learned about the needs for girls as far as products are concerned?
Yes, thank you so much, Natasha. I think the situation for menstrual health management product is very different from what people talk about and what really is on the ground. And why I say so, it's because you would find that most of the time it's all about when you reach your puberty stage, we're only introduced to pads if most, I would say, you are in urban. And for those in rural areas, you'll find just they use the piece of cloth. But the situation really, you would find there are a lot of things that other girls would use in these communities. But the most important thing that we would find is missing out to most of our adolescent girls and young women that we're working with, because we work with girls starting from the age of 10 to 24. But of course, from the age of 10 up to somewhere 16, that's why we experience a lot of girls are reaching puberty. And in our safe spaces, because let me just say this, we've got 40 dream centers in 5 provinces. And menstrual hygiene management is one of the topics that are not discussed openly in our societies. But in one of the topics that we have in Stepping Stones, we address issues of menstrual health management. So we are offering this, but we realize that it is very difficult for some girls to buy pads, and most of them are coming from vulnerable communities. So as such, we've trained a lot of girls in making reusable pads to make it cheaper or easier for them to have, to have pads. And we have the support from the USAID, who've really supported us in buying the machines, the materials, and training these girls so that at least they can make it cheaper for other girls to be using reusable pads. And at the moment, we've made more than 50,000 pads so that those that don't have money to buy reusable pads, we give them for free. so that we just encourage them to go to school and also encourage them to be free and mingle with other girls in the dream centers. Because in our safe spaces that we have for these girls, they're able to discuss issues of menstrual health. Thank you.
Thank you so much, Nelly. I just want to say I have been to the dream centers and worked with some of these girls, and it's just so amazing to see the willingness of young girls to take things into their own hands as far as menstrual products are concerned. I will ask you more about the products as we go, but for now, I'll ask Dr. Simpungwe. Dr. Simpungwe is a medical doctor, and she's the Assistant Director of Adolescent Health at the Ministry of Health. And coming from a medical background, a lot of young people on this call would like to know what are some of the health challenges that people are facing, and are there any things that can be done to prevent some of these menstrual health disorders?
Thank you so much for the opportunity to talk to young people who are listening to us. There are common complaints that come through from young people pertaining to menstrual experiences. So the first one is actually maybe the lack of starting having menstrual periods. Maybe during puberty, by age of 16, a young person has not seen the menses come through, and that can be as a result of various factors, including imbalances in hormones produced by the body, also physical or bodily abnormalities, especially in the genitalia. Then we also have a group of young girls who would have started having their menses, but along the way they start having irregular until they have absent, no menstrual periods at all, and that is also called amenorrhea, but in this case it's a secondary one. And this is caused by various factors, which include obesity. So increase in body mass or body weight can actually affect the functioning of the body. Certain hormones are produced and they affect how the ovaries and the uterus functions. That is simply put. And young girls who are also maybe on diet, strict diet, where they restrict food intake in terms of fat and carbohydrates, can also have issues to do with undernutrition, low body weight, which can also affect the normal functioning of the body. Normally, the body will register that it's in a starvation mode, and what will happen is that it will just reserve the fuel available to eat, depending on how much food you consume, just to maybe undertake certain processes, and menstruation is not part of the essential processes that will happen. So you cease seeing menstruations if you are underweight. And then we also have young people who are exercising a lot, who are under stress. I think that is also connected to underweight, reducing your body mass and reducing the composition of fat in your body. That also affects how the body functions. And one of the functions which suffers is, of course, the menstrual cycle. Then we also have the problem of dysmenorrhea or painful menstrual periods or cycles caused by certain hormones in the uterus. And we also have people maybe who have some infections. They can also have painful menstruations. Then the other common complaint we see is what we call menorrhagia. There's abnormal bleeding, increased or prolonged bleeding during menstrual cycles, and that has also different underlying causes, which can also include hormonal imbalances and also some other medical conditions. So how can we prevent this? Of course, some of these conditions can be prevented, others not. If you recall, I talked about amenorrhea, the first one where you don't see menses. Normally, there's nothing you can do about it as an individual. You need to seek medical attention so that you are examined and the cause can be established as to why the menses have not started. But for young girls who are experiencing absence of menstruation for more than 3 months after they had started, I think you can prevent that by maintaining a healthy lifestyle, exercise moderately, eat nutritious foods, and engage in activities that will reduce on stress. Menorrhagia or a prolonged and heavy bleeding, you can't prevent that. But what you can do, you can maybe just do certain things which will help you maybe relax, like we hear reports of people who have heavy bleeding, that they get tired easily, they can't concentrate. So you take rest, drink plenty of water, and maintain a healthy diet. And for those who have painful or dysmenorrhea, painful menstruation, there are some drugs that are available which you can use. Of course, before you even think of taking drugs, heating pad, something which can soothe your abdomen, your lower abdomen. Aspirin, brufen, diclofenac, Indosit, those are some of the drugs you can use to relieve the pain. I think what the drugs actually do, they work to reduce those substances or chemicals in the uterus that cause the cramping or the pain in the uterus. Thank you so much.
Thank you so much, Dr. Simpungwe. You've mentioned something about amenorrhea. I must say that I also used to have similar menstrual disorders, especially when I was younger, because I started my period very late compared to my friends. And I thought it was abnormal. And there are a lot of young people who come to us thinking it's abnormal, but the age that you should worry at should be at around 16. And there are a lot of places where you can get help for any menstrual health disorders. So for those that are just joining us, you are welcome. This is the Menstrual Health Day webinar, and we are talking about the MHM realities in Zambia. Feel free to use the chat box to type any questions that you may have or any concerns, or just to also say hi and tell us where you're connecting to us from. And our next speaker is going to be Mwangala, who is going to talk to us about the menstrual hygiene situation as far as sanitation is concerned. Mwangala, some people may not have seen you, so I will ask you to turn on your video. And it would be great if you just told us what are some of the biggest challenges around hygiene and sanitation in most of the communities where you're working.
Okay, good afternoon, everyone, for those joining us. Okay, so for the people to appreciate how our project is linking our linkage to menstrual hygiene, I'll start with a brief introduction. So SNV is implementing a Dutch government funded multi-country project. For Zambia, it's called the Chambeshi Lupanga project. So we are working in partnership with 2 commercial utilities, that is Lupanga and Nkabwe and Chambeshi up north. So, and for the 5 local authorities, we're working with Kasama, we're working in Mbala, we're working in Nakonde, Mpulungu, and also in Kabwe as well. So those are the 5 local authorities. 2018, we carried out a baseline study, and then the findings. So part of the findings were that most of our people are not connected to sewer. They are on-site sanitation, okay? And then also what came up was that there was unsafe practice of menstrual hygiene management, not only at community level, but also at institutional level. So with institutions, we are looking at the schools and also health facilities. Coming back to the challenges we are facing in the wash sector, in connection to menstrual hygiene management. First of all, we can talk about the issue of unavailability of water in most of these sanitation facilities. Okay, we find that we have toilets that are fine. We have toilets, but then those toilets do not have water, okay? Then also the issue of lack of soap. You have a toilet, maybe you can find water, but then soap is not present, you know. Then also issues of privacy. We have toilets that do not have a door. So for a girl out there, for a lady out there who wants to use a toilet when they're during their menstruation, do you think they'll feel safe to use a toilet which has no door? Or fine, there might be a door, but where's the lock? So issues of privacy in terms of menstrual hygiene and also water and sanitation, there's that linkage. Then also in terms of structure of the toilet, okay? Some of those cubicles that we find at our institutions, be it schools or health facilities or even public places, they are too small, the cubicles are small. So will such a small cubicle allow a lady or a woman to change her pad freely? You know, there's no space to maneuver if she has to put her bag somewhere, she has to change her sanitary towel. So some of those issues are really issues that have to be addressed. Then also lack of disposal facilities. Most of these toilets, be it in schools, health facilities, have no provision for women or ladies or even young girls to dispose of their menstrual hygiene products. So what happens? You find that these menstrual hygiene products end up in the toilet. So for those who are using flushable toilets, we find that people end up flushing these toilets. And what happens? It clogs the system. And then we have a system that is not operating or functioning properly. Then for those, one thing we discovered in the towns that we're working in, most of the people, despite having some water supply, they use pit latrines. So if you don't have a bin in the pit latrine, what happens in the pit, in the toilet, what happens? The menstrual hygiene products end up in the pit. And for us who are in the sanitation business, what that means to us, it means it will be extra work for the sanitation worker who is just supposed to empty fecal sludge. They have to deal with issues of separating menstrual hygiene products from the fecal sludge, which means that will be an extra cost to that family or an institution because it will take long to empty that sanitation facility. Okay. Then also we were talking about the use of reusable pads. Great innovation, but do our toilets allow our girls or ladies who are using reusable pads, does it have a space to hang those reusable pads? For example, a girl is at school, they have sewed their pants, they have sewed their skirt, and they want to wash their reusable pad. Do they have a place where they can hang it without compromising their dignity? And do they have water, availability of water? I talked about water. So water is not only water for washing hands, but it's also water which the girls or the women need to use to wash themselves in case they have soiled themselves. And then also in case they have to wash their clothes or their uniform. So all those issues, all those challenges surrounding menstrual hygiene management are things that we have to address as a WASH sector, okay? Then also what we found out was from the health facilities, from the survey, about 75% of health facilities had no provision for menstrual hygiene management. So fine, there was a toilet, but then no bin provided. If there was a bin, it was a bin with no bin liner. There was a bin with no lid. So it's all those challenges in the WASH sector that are really making it hard for our ladies to have their periods in a dignified manner. Thank you.
Thank you so much, Mwangala. It's very important to talk about disposal. And I'll ask you another question. What are some of the recommended ways of disposing menstrual products? Because this is something we're asked. There are so many rituals, even things that I was taught that now that I know, I don't agree with, like things like you have to wash the disposable pads before throwing them, and all those kind of things. What are some of the recommendations you can make on disposal, especially looking at the fact that SNV does deal with even the pit latrines? Because where I grew up, we had a pit latrine close by. And I always thought the pit latrine is somewhere you can throw things and forget about them. So what do you have to say about that?
Okay, so in terms of disposal, I think for the safe mode of disposal is incineration. But when we talk about incineration, then we are looking at institutional level. So we're talking about schools and health facilities, because I don't think there are any households who have incinerators. Maybe they are, but yeah, it's something that is at institutional level. So that's one of the safest. So, but at household level, really, it's something that we've been part of a technical working group with SABS, where we are trying, where we and other stakeholders are trying to discuss the way forward in terms of coming up with guidelines for disposal of menstrual hygiene products. Because what happens at household level is where if people don't practice open burning, they'll just tie it in the plastic, and then it ends up with the household solid waste, you know, and ends up at a municipal dump site or something like that. So in Zambia right now, we don't have a guideline that states this is which is safe and which is unsafe. But for most countries, I think we have our projects as Bangladesh, and we have the Nepal and other Asian countries. Most of them accept incineration as a safe way of disposal. Okay, but for the least we can do for our ladies, for the girls, is provision of bins, at least in a sanitation facility. We provide a bin with a liner and a cover. And most preferably, we can talk about bins, pedo bins, so that there is no contamination with the person disposing of that menstrual hygiene product. Yes, thank you.
Okay, thank you so much, Mwangala. For those that are joining, you are welcome. My name is Dr. Natasha Kaoma from Copper Rose, and we are discussing menstrual health management in Zambia. We've been receiving a number of questions through our email, but I'll encourage people that are online to just type any questions you may have in the chat box. I'll read some of the questions we have so far, and I'll ask any of our panelists to address them. We received a question from Obed Mambwe, which is very similar to the question from Sangwani Sichinga. And the question is, what are your organizations doing to reach out to deaf women and girls both in and out of school? This section of society, including those with special needs and abilities, are lacking access to information and knowledge, and they're often marginalized. Does anyone want to say something about this?
Yes, let me say something on that one. With what we've been having in our dream centers, we've been having adolescent girls and young women who've got special needs coming through. And what we realized was we have not put much of the effort in terms of addressing their issues. But we've got Chilenja Dream Center who are working with one of the schools nearby, which they're offering special education. So what we've done is, in our safe spaces, we've also involved some of their teachers so that at least it's easy for them in terms of sign language interpretation and other needs that they may have, so that they can also address their issues. Thank you.
Thank you, Nelly. Does anyone else want to share?
Yeah, thank you very much. I think under our unit, Adolescent Health Unit at the Ministry of Health, we've started translating the available IC materials on issues affecting young people into Braille and sign language. So we have partners who are supporting us. So far, we have some materials already translated in Braille. For example, family planning, and we also have a booklet called Passport to Health, which has a number of topics on health problems affecting young people. That has also been translated by UNFPA into Braille. And we are in the process now of convening a meeting. I think we've just been delayed because of the COVID, to translate the same materials in sign language. We have funding to that effect by the Global Fund. So we've also realized that there's a gap in this area, and we are working closely even with the Deaf Association, so they are waiting on us to work with them. Thank you.
Okay, thank you so much, Dr. Simpungwe. It is true that there are some organizations and a lot of institutions that are looking into this. As Copper Rose, what we've been doing is we usually incorporate those with special needs into our existing programs. We have a program for girls in Kafue with the Amos Youth Center, And usually when people come in for the sessions, we do translate on the spot, or we do still offer pad sewing sessions with the girls who usually come through. The approach with that partner that we have is that they usually incorporate these people within the structures, because they sometimes feel excluded when we say we're having a training just for the deaf, or we're having a training for those that can't see. So what the approach that we've been taking is that we usually incorporate them, and the trainer or the facilitator will be either much slower, or will work with a translator or a teacher who already has this kind of information. But I do agree with you, Obed, that there is need to be more deliberate and do more work and activities around those with special needs. Thank you.
For Copper Rose. Apparently, Inangelina is in attendance. Inangelina, the vice president, is in attendance.
Oh, wow. So I've just received, I don't know whether I can say I've overheard or I've heard, but I hear that our vice president is in attendance. I'd like to say welcome, and it's really an honor to be having this webinar, having you join us for this webinar. So I will go ahead with the program, and if possible, she can say hello to everyone. As we go. Okay, so the next question is from Walia Lombe. So Walia was asking about the cost of menstrual protection. So it says, looking at the cost of pads, lots of girls can't afford. What is government doing and other partners in terms of distribution of the protection? Because there were some pronouncements that were made. How far has this gone, and what can partners do to support girls with these products? Anyone? Kasweka, maybe?
From the Ministry of General Education, as I alluded to earlier on, the cost of the sanitary materials, we know that it's high and most of our learners cannot afford. So what we're doing, as it was earlier pronounced, is that we are trying to distribute sanitary materials to all schools countrywide. And also, we're trying to make sure that each school, as they make their annual budgets, they should have a line where they're supposed to procure menstrual hygiene materials, so that in case of any emergencies, each learner should feel free to approach the teachers, and so that they're supplied with sanitary towels. So as a Ministry of General Education, since 2014, we do have a line where now, when we're budgeting our annual budgets, we do have a line where we set aside some funds where we procure sanitary materials for our learners out there, especially in the rural areas. But you agree with me that these are not enough. So we also have another avenue that we look at in terms of each, like all the schools having sanitary materials. So we also have a program where we actually go into our schools and we train them on making reusable sanitary materials, because we know this is more sustainable than them buying the disposable ones. So we've got this program and the 2 kits in where the learners are taught or trained in making sanitary materials. Using the normal materials that we have, for example, the chitenge materials that are easily accessible, even in rural areas. But as a government, our plans are to procure sanitary materials, at least for emergency packs in all the schools, so that those learners that cannot afford, they can be given. But this is costly for us, but it's in process, where we are trying to deliver this to all schools.
Thank you, Kasweka. What does anyone else want to make an addition to that?
I think maybe for under the Ministry of Health, we don't have like a direct line where we support adolescents who are not able to afford sanitary towels. But what we do, we normally work with partners, organizations that are willing to work with us to reach young people we are actually interacting with during our normal delivery of health services in our catchment areas. So we actually don't have that that vote or allocation to go that way. But our hope is that maybe through other line ministries like the Ministry of Community Development and Social Welfare, maybe through that ministry we can have more access maybe to products that we can distribute to young people we are reaching during our interaction with them as we are giving them or providing health services to them.
What are some of the long-term strategies that you think would work? Maybe I'll ask Mwangala, coming from SNV, which is a global organization. What are some of the things that other countries are doing as far as provision of menstrual health products is concerned?
Okay. As SNV right now, for our project, we don't have a budget line specifically for providing pads to the girls, but we've taken a step further by engaging, by working with organizations like yours. So we have an MOU with Copper Rose. So what Copper Rose will be doing is help SNV, or actually just raise awareness in terms of menstrual hygiene management. That's what we've been doing. So if there is something, obviously, for example, for this commemoration for Kabwe, we have sourced some menstrual hygiene kits, which will be distributed to about 6 schools. So even if we're not commemorating today, it'll be done next week. So that's the type of support we can do, but then there's no budget line specifically for purchase of pads. Thank you.
Okay.
Yeah, maybe I can also add on something on that. For us, it's more of economic empowerment. So what we do is we've got materials, machines, and we've trained these girls in making reusable pads. So they're in groups, and in all our 40 dream centers, they're making these reusable pads, and they're selling. And as they sell, they get the percentage and save. They're in these village banking groups so that at least the same money can help them in terms of sustainability. So we only give to those with a discretion from the center manager that they are coming from a vulnerable family. That's when we give them for free. Thank you.
Thank you so much, Nelly. It is true that in order to have good menstrual health, we need to do something that is sustainable. And as Copper Rose, we believe that if either provinces or different areas have their own ways of manufacturing the pads, that will take us a very long way, because even as a country, we have very few, if any, that are producing disposable pads. And our recommendation is that long-term, it would be great to have our own manufacturing plants, so that even when we say the government is giving them for free or other institutions are giving them for free, that money is being plowed back into our economy. Yeah, so there are so many questions in the chat box, but before we get into those, I will just ask our speakers a few more questions that were present before the meeting. And my question is to Nelly. You had spoken about how your organization is producing some pads. How has this been affected by the COVID pandemic? How do you think the COVID pandemic is affecting menstrual health? We've seen the hashtag periods don't stop for pandemics. What are your thoughts on that?
Okay, thank you so much. So generally, COVID-19 has affected the operation of the project activities, but with the exception of the causal component. The causal component is the component where we're making reusable pads, because even in this period, people have been coming to order more pads from us. And in addition to that, we are also making masks. We've taken advantage of this period so that we are making masks. Our girls are making masks so that at least they're able to sell to other members of the community. But our only challenge is in terms of door-to-door marketing and the schools which are closed. So you'd find these pads, when they are made, they are sold in schools, the nearest schools, and also door-to-door in the communities. But you'd find it's very difficult for our adolescent girls and young women to go to these schools and in other communities. But generally, our component has not been affected because of, like you've said, periods don't stop. So it's been the same. People have been coming to order, and we've taken advantage of that. Thank you.
Okay, thank you, Nelly. Kasweka, what are some of the policies that government has put in place? I've seen a question from Rebecca where she's asking about the menstrual health management guidelines. What are some of the ways in which government is incorporating these into the day-to-day work? And are there any additional policies that are in place for menstrual health management in Zambia?
Okay, thank you so much, Natasha. As I said in my opening remarks, as a ministry, the issue of menstruation for girls is our biggest concern, because after the research that we conducted, we realized that our girls are lagging behind in terms of performance behind the boys because of the challenges that they face when they're menstruating. So first of all, I'll give a brief background how the government came up with this toolkit and the guidelines on MHM. We did a research, and in this research, it came out that most of our girl child, like the learners, they stay out of school when they're menstruating because of the lack of the knowledge they have on menstruation, because lack of accessing materials, and even disposal of the sanitary materials. So what we realized that there's lack of information in the communities. So we came up with the guidelines that basically we look at 3 areas. First of all, it's about sensitization, sensitizing the girl child, even the boy child and the teachers, as well as sensitizing the community, because we believe that menstruation affects everyone, starting from their home or where the learner is coming from, the community, even the school. So our guidelines are threefold. We look at impacting knowledge, sensitizing the learners, as well as the community where they're coming from. Then we also look at the issue of supplying the materials. As we've been discussing, the issue of having sanitary materials is a big issue. And as I said before, even though we do advocate of providing for disposable sanitary materials, we do realize that these are expensive. So we are advocating for our learners for the sake of sustainability, for them to make reusable sanitary materials. So you find that in our guidelines and the toolkits, there's a section in which we do train our learners on making reusable sanitary materials. And this is also a money-making venture for our schools, because these are sanitary materials that are made by the learners themselves in the clubs that are formed. They can resell them to the learners in the schools at an affordable price. And then apart from the provision of materials, there's also an issue of disposal. What happens? How do the learners dispose of this? So you find that our toolkit and guidelines, it's a document that looks at how all the schools from private, and by the way, these documents, the private schools are also free to use these documents, because it looks at how menstrual hygiene management can be conducted in schools. It looks at how, as the ministry and the community, how the girl child can be supported. And we look at impacting knowledge, even to the teachers, how they should handle the learners, even the issues of disposing, because right now we're even changing the design of our latrines. I heard someone mention something about having privacy. This is a big issue. we look at the issue where the learner should be free in case she wants to go and change. She should be free to go somewhere in the sanitation facilities where there is privacy. So you find that the Ministry of General Education, together with its partners, we've engaged in constructing new sanitary facilities where you have showers in there, where the learners can go and change, they can wash in case they've got any accidents. These are issues that affect the girl child. We may look at them to be small and say, but why do we need showers in schools? But accidents happen all the time. So we feel that if a learner is confident enough to go to school and know that in case anything happens to me, at least I can bath, I can change, I can dispose of my sanitary material. These are important things that every girl child should be free. And the fact that we're training our teachers to say, let's talk about menstrual hygiene management. Even our boy learners, the boy child is also being sensitized in this area, because we know that at the moment, gender-based violence is very rampant in schools. And part of the reason is because of the girls are being bullied when they're menstruating. So by giving knowledge even to the boy child, sensitizing them on what menstruation is all about, you find that the girl child is earning support from everyone. So because of this, you find that in our toolkit and guidelines documents, all these areas are being handled there, so that the schools should have the full package on how they should handle menstrual hygiene management. Thank you.
Thank you so much, Kasweka. For those that are joining us, this is the Menstrual Health Day webinar, and I'm the host, Dr. Natasha Kaoma. I was supposed to be talking about MHM facts, but I just got so carried away with these exciting conversations. So I have fact number 3 and fact number 4, and these are talking about Zambia. Did you know that 47% of girls miss classes during menstruation in Zambia? And fact number 4 is that 13% of girls know people that have stopped school completely due to embarrassment. And these facts, I have gotten them from the report from the Ministry of Health, which was compiled in, I think, 2012. And we're looking to see what further research can be done around menstrual health. But these are some of the facts that we have on the situation in Zambia. So I'll dive a little bit into some of the questions that have been asked. And if you have questions, feel free to post them in the chat box. We have 2 questions from Loretta and Stella. I think I'll direct this to Dr. Simpungwe. The first one is, what does it mean when you have clots in your period? And the next one is, why does antiretroviral therapy stop menses? I must say that there are doctors on this call, but this is not a clinic. But Dr. Simpungwe, since we've taught people that they can ask, would you be able to answer these 2 questions? So 1, what causes clots? And 2, what causes antiretroviral therapy? What effect does it have on menses?
Thank you so much. I'll try to respond to the 2 questions. I think all of us are aware, for women who are on the floor, we are aware that under normal circumstances, menstrual blood doesn't clot. When everything is normal, the flow is normal, but in instances where the flow is very heavy, actually the body uses up clotting factors, can I call them that? Substances which not clot, substances which promote menstrual blood to remain unclotted are used up. So at the end of the day, you find that the blood which is supposed to be clot-free starts clotting because it's too heavy, and the body has used up substances which keeps it free of clots. So normally it happens during heavy, prolonged menstrual periods. On the antiretroviral drugs, I'm not sure. Maybe if we have someone on the line to to help us. But generally, when you have substances that affect the normal productions of hormone, which affect the ovaries and the uterus, normally if that system mechanism is disturbed, that is what can cause menstruations to cease. But if there's anyone on the floor can specifically maybe explain how the antiretroviral drugs affect the ovaries, the uterus, and the system in the brain that regulates menstruation, maybe they can explain. But generally, the system somehow is disturbed. I don't know if there's anyone on the floor to help us, Dr. Kaoma.
I can see some doctors, but I don't want to pick on them because they'll shout at me after this. But I think we will go ahead and we'll get back to this. If there's anyone who wants to take this up, please feel free. But I think that in summary, it's just that it affects the hormonal control. So some of the antiretroviral drugs affect the distribution of hormones, and that affects the menses. And it's the same thing that affects other things, like some people develop hair on their face, and other people, for men, sometimes they develop breasts, and all that has to do with the adjustment in the hormones, which is a side effect of some of the drugs. But also, I hope that some people didn't get scared of what Dr. Simpungwe said. So if something like that is happening, we also have to remember that menstrual flow is not only blood, but it's also other the lining of the uterus, and sometimes that may also have clots. The last question is going to go to anyone who wants to answer this. And the question is from Lorita, who is asking about period poverty. I think a number of people have touched on this, but I just want to ask it again. What do you think are some of the responses that we can have for menstrual health management in rural areas? Because a lot of interventions are targeted in these urban areas, but what are some of the interventions that are known to be useful and that are known to work for girls in rural areas?
Maybe I can just propose something.
Yes.
I think maybe it's important for us to appreciate where we are coming from, and our resource envelope as a country, and also to appreciate the fact that there are families that can afford, and those who can't afford sanitary towels. So in rural areas, in families, not even just in rural areas, even in urban areas where families can't afford, they're encouraged to use clean cloth, as long as it's well kept, it's washed, it's ironed, hung maybe in sunlight, so that all the germs die. Actually, that is the cheapest and safest way to go than really to break our heads and think everyone should use this product when they can't afford. Where we are coming from, most of us have used that in the past. I don't know how many of us are older than yeah, older than 50 or 40. We've used cloth in the past. We were educated on how best to handle the materials, how to look after them, how to hang them. So I think for now, where really people don't have resources, that is the way to go. As and when people are able to afford, they can buy reusable pads, but let's embrace all possible materials that are available, depending on the capabilities of families, so that we don't maybe downplay on what has worked in the past for years and for centuries, as we are striving to maybe introduce more expensive and modern products. Thank you.
Thank you so much, Dr. Simpungwe. Somebody has asked Nankonde, she's asked, what is the status of removing of taxes? This goes out to anyone on the panel. What is the status of removing of taxes for menstrual health products in Zambia?
I think from the Ministry of Health point of view, I was told that is maybe an agenda we are not pursuing as a ministry, but we've heard that there are some members of parliament who have brought that topic on the table for other parliamentarians to discuss, but we are yet to hear any feedback. I'm not sure if it has been discussed, if anything has been resolved, but from the Ministry of Health point of view, it is something we are also waiting to hear from champions who are trying to support this cause as individual parliamentarians, for example. That's what I've been informed.
Okay, thank you. Does anyone else want to make a comment on that? Well, since none of the speakers is saying something, the issue of taxes is very controversial. I've seen two approaches that have worked very well. The first one is removing of taxes completely. And the second one is where the taxes that are paid from menstrual health products are redirected towards giving free products to those that can afford. For example, the United Kingdom government does receive taxes, but all the taxes on menstrual health products are directed towards providing for those that don't have. And so that makes it sustainable, and it helps those, it allows those who can afford to pay and support those who can't afford. So those are some of the approaches that Copper Rose, for example, has been recommending. It's okay, do we remove taxes? But if we don't remove taxes, how can that money that is from menstrual health products be used to help those that don't have? So there are a lot of more questions on the chat box, and continue to encourage people to ask more questions, but I can see here that some of the questions have already been tackled. Loretta has asked about the Ministry of Health guidelines. I think Kasweka already tackled this in the earlier conversation, but I just want to talk about something that BBN has shared, which is on bullying and shame that comes with menstruation. Dr. Simpungwe, what do you think is the role of parents in things like these? Looking at the culture and how we are raised as girls, and even how boys are raised in conversations like these, what do you have to say about this?
Thank you so much. Where we are coming from, discussions around sexual reproductive health were actually a preserve for aunties and grandparents and counselors or traditional counselors within the community. But I think looking at the setup of families now, where we are living as nuclear families, where our distant relatives are very far away and we rarely meet them, I think it's now the responsibility of mothers to inform, especially the girl child, about the process of puberty, portraying it as a normal process, so that young girls can actually develop the good attitude they require towards menstruation and also good menstruation practices. We can't leave this important process to young people to educate themselves. I think that is normally what is happening for mothers who still feel it's a taboo to talk to their girls. So it is their responsibility to open up to the young girls, prepare them so that they don't feel it is a very abnormal thing, embarrassing thing that will happen to them. And aside from that, I think it's also the responsibility of parents to ensure that they provide menstrual hygiene products or sanitary towels. We've interacted with young people in various districts and provinces, and sometimes it's sad to hear that some parents are actually asking girls to look for items like sanitary towels for themselves. They'll say, you are a grown woman, you can look for money, I can't look after you, you can do something and provide these products for yourself. So I think this is something which parents should take seriously, because as you earlier on shared, no one wants to stay without sanitary towels or hygienic products. So we need, as parents, as guardians, to provide the sanitary towels that the girls require, so that they are not forced to engage in transactional sex, so that they are able to meet these basic needs. Of course, the boys as well, since some of the schools or most of the schools are co-schools, it's important for parents as well as teachers to also educate the boy child on this natural process. I think the CSC syllabus that has been incorporated in the school curriculum, I think, covers that topic. And when students or pupils learn about menstruation, I think both boys and girls are taught the same. I think what is taught in school should be supplemented by parents at home, so that we move as a unit to support the girl child, not to feel embarrassed about this natural experience. Thank you.
Thank you so much, Dr. Simpungwe.
Maybe Doc, before you go, maybe let me just add a bit from Dr. Simpungwe.
Sure,
Yeah,
Nelly.
I think like what Dr. Simpungwe said, parents and their children, they need to create a very good relationship in terms of communication. That's how come there is a very much disjoint in terms of what children know and what they begin to share. Because at as early as 7, 8, 9, 10 years, parents and children should have that strong relationship in terms of communication, such that a child will be very free to share with their parents. And it should not just be for girls, but for boys only. And why I say so is because nowadays parents have become so busy that they don't have time to talk to their children. So I think it's the relationship that we build with these children, even when they've got anything to ask about menstrual hygiene, they'll come to us and not leave other people to do our work on our children. So we need to make sure as parents that we create time for our children. We talk to them, we tell them about realities, so that when they get it from us, even when they go and learn from somewhere else, they will just be adding up on the information that they know. Thank you.
Thank you so much, Nelly, and thank you so much to everyone for staying with us this long. We will be coming towards the end of this webinar, and so from here, I'll ask the last round of questions to our speakers, and then we will continue chatting and texting. If you are still looking for ways to engage and ways to get involved, you can tweet about it. The hashtags we are using are hashtag MHDay2020, hashtag Candid Pride, and hashtag periods in pandemics. So I'll do the last round of questions and we should close. They always say you want to end while things are still exciting. So I will do just that. If your question hasn't been read yet, I may still read it because I'm still going to ask, but also you are free to send emails and we'll continue discussing because we are still having this menstrual health week. My question is going to go to Kasweka, and this question is coming from Inonge. Inonge is asking about provision of wash facilities, for example, showers. How practical do you think this is in schools? And is it practical for people to take showers during menstrual accidents? How do you see this working out, having a shower in the school?
Thank you so much for that question. As I said earlier on, as a ministry, we're providing our schools with the menstrual hygiene management toolkit and guidelines. And in there, you'll find that we encourage our teachers, because we do conduct training. And when we're conducting trainings, the trainings comprise of the teachers, the learners, be it male, female, and even the community participation that are also involved in there. So in there, we orient them on menstrual hygiene management. And as part of our orientation, we do tackle issues of sanitation facilities. As I alluded to earlier on, we look at the issue of showers. It is, as I said, every girl should feel comfortable to say, if I have an accident, or even if you don't have an accident, you do need to change your sanitary material. You can't have it on the whole day. After 2 hours, 3 hours, one has to go and change. So as a ministry, we are looking at our girl learners to be free for them to go and change. So this is why we're providing privacy in our sanitation facilities, where our learners should be able to take a shower in case they do have an accident. And in order for this to happen, we do need water supply in our schools. And this is why we work with our partners, for example, SNV, even UNICEF, to help us in this area. But also we do encourage our schools to have drums in their schools, even in rural areas. We do encourage them to fetch water and store water in drums and make sure that they have water in their sanitary facilities, so that when a girl wants to change or they want to take a shower, there is water. So the issue of water not being available, we do train them that even if they don't have piped water, they should, at least each school, be it in the urban areas or rural areas, they should store water. This is the reason why we are sensitizing our schools with this toolkit and guidelines that we've developed. It tackles all these areas on how the teacher should be able to support the learner, be it if it's a female teacher or a male teacher. The child should be free, if they have an accident, to approach their teacher to say, excuse me, for 10 minutes or so, and they should be free to go and take a shower. Thank you.
Thank you, Kasweka. Mwangala, as a behavioral change advisor, what do you think is the role of men and boys in menstrual health issues?
All right. As a behavior change and communication advisor, I feel for us to deal with menstrual hygiene and its management, we have to include men and boys, okay? Because we have a lot of myths and taboos surrounding menstrual hygiene. And then most of these can only be dealt with if we include our male counterparts in dealing with this. For example, I got my first menstrual hygiene products from my father, okay? So for me, growing up, menstrual hygiene management wasn't an issue because we had that connection. So I feel it's something that can be done at household level, at institution level, where we include our male counterparts. We talk about gender equity and social inclusion. So when we talk about gender, it's not only for the women, but we have to include the males as well as people who are going to spearhead for us to achieve total management of menstrual hygiene. Thank you.
Thank you so much. Dr. Simpungwe, somebody has asked, I think it was Bibian. I have two questions for you because there was one question I had and now I have to add one. Okay. But the first one is there such thing as an ideal menstrual health product? And the other question I have is, if you were a girl right now, what do you wish, what would you wish, okay, maybe let me say this. If you're an adolescent girl, what would you wish you were told?
Okay, thank you so much. I think maybe before we proceed, I wanted to respond to that first question on antiretroviral.
Yes.
I just came across something which is explaining that actually most of the women who are on antiretroviral drugs, especially when they just commence treatment, they experience poor appetite, loss of weight, and some of them are also being treated for other ailments. So ARVs themselves have no effect on the menstrual cycle, but we can maybe dig deeper, talk to the clients who are or the patients who are experiencing menstrual disorders, whether they are on other drugs, whether their eating habits have changed, whether they've lost weight, and those are some of the things which researchers have established as being contributing factors to menstrual disorders among women who are on ARVs. So it's not ARVs, but other conditions, other drugs that women who are on ARVs are also experiencing. So I think we've responded to that question. So the ideal menstrual product, I think the ideal one, to me, it would depend on the individual. You know what I'll consider as individual, but from the medical point of view, I think something which is safe, which is not causing maybe allergies, reactions, something which is able to absorb the menstrual blood, and safe to use. Actually would be ideal, and it will differ from product to product. There are some which are scented, some people they react to the perfumes that are added to the products, so it will depend, but something which is safe, which won't cause allergies, which won't cause infections, which will, like now they are promoting products that are able to really absorb and retain the top layer dry, so that the bacteria is not provided a conducive environment to thrive, to grow, something which results in infection of the urinary tract and the respiratory, the reproductive tract. So for me, that is an ideal product. Actually, it's objective, it's subjective, sorry, depending on how you react and the amount of menstrual blood that you discharge during your menstrual cycle. Then the other one was what I would have loved.
Yes, to know.
Yes, I think I learned from my friends that there's menarche, there's menstruation. I didn't hear from my mom. That one I didn't. I think I was, it's like even your friends tell you, when you see blood, you tell now your parents, but I didn't hear it from my mom. And I think that is something which would have meant something to me, because I didn't get all the information that I know about menstruation. And I'm sure that is the struggle that most mothers are going through, because it wasn't done to them, so they don't know how to approach the topic with their adolescent girls.
Thank you, Dr. Simpungwe. That's very true, actually. For a lot of people, it's been something to get information from the home. But like you said earlier, we have come a long way, and we're seeing a lot of changes that we should celebrate on how parents are willing to even have these conversations, but definitely we can do a lot more with that. My last question is going to Nelly, and I just want you to say something about how do you think young girls or young women should handle menstrual health management in this time with COVID. I know you did mention some of the things that the Dreams centers are doing during the pandemic, but what additional advice do you have for girls and for even people, organizations that are working with girls?
Thank you so much. I think, like I said, because most of the parents have lost employment to COVID, and even other people, they've been hit badly by COVID. And what we are encouraging our adolescent girls and young women in our Dream Centers is to continue making these reusable pads, because at least at the end of the day, they're getting something. But also organizations that are listening now, people that are on this forum, please come to us if you want reusable pads. We'll be able to supply to you quality ones with good material. Already today, we are dispatching some materials, going to different Dream Centers, and also our prime partner plan has purchased 40 machines for our Dream Centers that we're distributing. So already we've got the capacity, we've got the materials, and we just want people to come forth and make orders and support us. But of course, we continue encouraging the girls that with this menstrual hygiene, continue being the matter of discussion in the safe spaces that they have, because in safe spaces, even when I was an adolescent, we're able to share information, but at least there's a mentor who is able to give them correct information in case there are some myths around menstrual hygiene. Like we know to say, I think it's you or Dr. Simpungwe who said sometimes your pad cannot, I remember when I was growing up, some people would say your blood stain should not be seen by any man because you never have a child when you grow up. So, I've grown up with that. Even when you try to, your periods are about to start, you make sure that you take care of yourself. So we continue supporting our girls, and also continue encouraging these boys to support the girls in schools and in our communities, because by doing so, we'll reduce the cases of girls being embarrassed and also helping our girls to have high self-esteem. Thank you.
Okay, thank you so much to our speakers, and you can type in your contact details for those that may want to contact you. There's one last question which was asked, or a comment that I'll just make, which was made by Malala on correctional facilities. As an organization for Menstrual Hygiene Day, we will be donating pads to the correctional facilities. It is because we are aware that for most of the correctional facilities, a huge portion of their menstrual protection comes from donations. Now, with the COVID pandemic, people are not going there to make donations, and there's a huge need for menstrual protection. So as an organization, we will be making a donation to the correctional facilities, and we'd just like to encourage those that are interested in donating, even in their own capacity, to just think about those women, especially during a time such as this one. Before I share our call to action, I just want to say that we had a competition on our Facebook page where we asked people to put up a message for menstrual health, and we do have some winners that I want to announce. And so our winners are, the first one is Bibian, and the second, Bibian is going to walk away with, I think, a mobile phone. Nelly, are you able to mute yourself?
Sorry.
Okay, so our first one is Bibian, and the second person is Janet Mwanga. Janet Mwanga will walk away with, just hold on. I think it's a MiFi. And the third person is Sylvia, who is going to walk away with a power bank and a hot water bottle. So we had this challenge where we're asking people to send out a menstrual health message and ask them to get people to like and share. And so far, I would like to congratulate these three winners. You will be contacted by someone from our team to let you know how you can access your prizes. But also, we'll just encourage everyone to keep sharing and keep spreading the message about menstrual health. As an organization, what we'd like to share with everyone on a call to action on this Menstrual Health Day is going to be targeted towards the different people that are on this call. For the young people that are here, I think we need to use our social media and everywhere we are to just spread the word about menstrual health, and we need to be an example and not be ashamed of it ourselves. For parents that are on this call and even out there, we just want you to encourage you to talk to your young people. Talk to both the girls and the boys, because the boys, they sometimes laugh at their friends, and that makes their friends uncomfortable, and that's what brings some of those self-esteem issues. So parents, we really need to talk to our children. Just as Dr. Simpungwe said, it's very important for us to communicate effectively, because charity does begin at home. For NGOs, as an organization, we've been doing work over the last 5 years, but one thing we observed is that we can't do great things by ourselves. And so as Copper Rose, we've been building capacity of other organizations to incorporate menstrual health in their work. So we have been doing a lot of menstrual health mainstreaming. We have even worked with the Pact, with Nelly and her team in incorporating menstrual health in their programming. So that's something that we are able to do, and we encourage anyone that works with girls and young people to think about this in your programs. So our call to action to NGOs and partners is to think about menstrual health, because it affects them. But even if you're doing any other subjects with young people, it's something that most people will remember. I remember during the adolescent health trainings that we do with healthcare providers or even other people, and when you ask them to tell you about a memory in their adolescence, most of the times it will be about menstruation. So I think this is something that we should think about. And for government and anyone with ties with government and some of the government officials that are on this call, we are really grateful for all that you're doing, and we hope that we will continue to see menstrual health as a very important issue, and we are so happy that you could join us on this call and speak to all the people that are in attendance. But from me, I just want to say thank you so much for joining this call, and I hope we can continue to be engaged. We will send out an email just with any other information that you might need and with possible contacts. But if you want to share your contact or you want to say anything to anyone on the panel, you can just type in on the chat box right now, or we will share some of the ways that you can contact us to deal with any further questions that you might have. Otherwise, thank you. I don't know if any of the speakers want to say any last words before we go.
Do we have maybe a word of encouragement from the higher office? Hello?
Hello, I can hear you.
Hello? Yes, I was wondering if there was, I think you mentioned that we had the VP with us. The VP is with us.
I'm still, well, that's what I heard, but I'm not sure because I haven't gotten any further feedback, even after trying to reach out. So if
Okay. So I think the maybe closing remarks from my office and the Ministry of Health, Adolescent Health Unit in particular, is just to thank Copper Rose for partnering with the ministry to raise awareness on menstrual hygiene management, and also other partners who are helping us provide services that young people require beyond health services, because we are aware that young people are faced with diverse challenges that cannot be met by one single sector, and we are appreciative for all partners like yours who are available, and others who are also providing other services that really complement what we are doing, especially to support a natural process like menstruation. Thank you so much.
Thank you, Simpungwe. Kasweka, you're on mute?
Yes, please. Yes. From the Ministry of General Education, we just want to say thank you for having made us be part of this panel. What we just want to say is that as a ministry, we work with different partners like yourselves, but I would also want to say that at the moment we worked with JICA, and we're actually delivering a lot of menstrual hygiene sanitary materials countrywide. So far, we've delivered in 3 provinces, and we're yet to deliver in other provinces. So this is to say that as Minister of General Education, we are working tirelessly to support the girl child, and this is one issue that we take seriously. And if there's anyone on this panel that wants to work with us, you're most welcome. And thank you so much, Copper Rose, for making us be part of this. So thank you so much.
Thank you, Mwangala and Nelly. I'm not sure which of you will go first.
Okay, all right. Thank you very much for having us. Then from my end, we're talking about menstrual hygiene management realities in Zambia. The reality is that we have a lot of wash issues that we have to address. So for us to attain SDG 6.2, we have to make sure people, stakeholders, NGOs don't work together. There has to be some synergies seen. We have to address issues of water and sanitation for us to safely say we have safely managed our menstrual hygiene in the country. Thank you.
Well, I think from Pact, we just want to thank everyone else for supporting our girls in all our dream centers. Please continue supporting them in the works they're doing. It's not easy because some people are learning about the reusable pads, and it's we need to continue giving out information, and also those who would want to come on board, where especially like the question that Obed Mambwa said in terms of adolescent girls with special needs, it's something that we should start thinking to explore how they can also be part, and also how we can help them. So I think from our end, we just ask that we continue supporting each other, and the happy Menstrual Hygiene Day. Thank you.
Thank you, everyone. Thanks for joining. And that's it from us. And yeah, it's been amazing.